Good morning, good afternoon, wherever we happen to find you today. My name is Judy Thompson. I'm the Director of Education for the Association for Vascular Access, and I'm excited to have you here for our webinar today. Dr. Hudson Garrett, his bio is up right now, and I know it's been up for a little bit, so you guys can all read it. But I wanted to share a little bit more about Hudson for you, or Dr. Garrett. Hudson and I go way back. He has many professional accolades, as you can read in his distinguished bio. But also, you should know he's a devoted father to his chocolate lab fur baby named Flash. And he is eager and always there to help the Association for Vascular Access, our membership, and the people at large. And we are very grateful for his expertise. He goes above and beyond for this organization and for the people out, the public that he is doing this webinar for today. And I sincerely thank you. I think the information you bring to us is amazing because it is not graded with a red or blue slant. It's not CNN, it's not Fox News, it's just the facts. And that's exactly what we need to know when we're dealing with a pandemic. So again, we do thank you sincerely, Hudson. Without further ado, I'm going to turn this over to Hudson. Thank you, Hudson.
Perfect. Thanks, Judy, and good afternoon or good morning to each of you that are on the line today. We're excited to see several names coming back for more, and we also appreciate all of the outstanding questions that have already come in today. As Judy mentioned, I'll do my very best to answer any and all questions that you have. If I don't have that answer, I'll be committed to get it for you. Really, our purpose for today is to go through some of the updates that we've learned from the COVID-19 infection outbreak. And with all of the civil unrest going on right now across the country, unfortunately, we're going to probably see some additional waves of this just due to social distancing and lack of use of masks. And we'll talk a little bit about that as well. One of the things I did want to focus some time on, there were many questions about testing, specifically antibody testing and what that means. And so we added some content on that. And then lastly, we'll finish up with what I think is the most important part of this program, which is how to keep yourself and your family safe during this ongoing pandemic. As we talk about we always want to refer you back to the Centers for Disease Control and Prevention. That's the most up-to-date information, as well as it has links to global resources. A lot of the content that we're talking about today will reference you back to that as well. And they do update this website periodically throughout the day. And then lastly, your local health department has tremendous resources as well as assistance that you can always reach out to as well. One of the most difficult things that I think I've seen in this pandemic is a picture just like what's on your screen right now. When we look at this, we see a long-term care resident that is stuck in a nursing home with her family outside. Potentially that's her husband there and maybe her daughter, and they can't see her. And keep in mind that this has been going on in some areas since late February. So we're now into June, and these relatives have not seen their loved ones in person. And so there have been some pretty extraordinary acts of kindness with nursing home staff. We've seen a lot of support from the community, but simply being able to, see your loved one is one of the most important things that we've learned from this pandemic is how do we do that safely and what do we do long term? As I mentioned in the last program, there were a lot of general questions about what is COVID-19 in the first place, and COVID-19 itself is actually the infection that's caused by this novel coronavirus. And so there's sort of this back and forth, and people use the terms interchangeably, but the virus itself is a form of a SARS virus. It's a CoV-2 virus, but the COVID-19 refers to the actual illness that's caused by that virus. And so when you hear someone has COVID infection, that means that they're actively infected with the novel coronavirus. And we'll talk a little bit about what infected means here shortly. I did want to provide some updates on the clinical presentation, meaning what does it look like? Are you going to typically see signs and symptoms? If not, what does that mean? And we've realized over the last few months, especially over the last few weeks, that there's a high percentage of these patients that may not be symptomatic. They don't have any symptoms. So they're not coughing, they don't have fever, they may have some mild cold symptoms, especially when we think about the kids. So it's very important that if you go to your workplace especially, that you're not only having your temperature taken, but you're also being asked questions related to symptoms as well as exposure. One of the questions that came up via email from the last webinar was, what do I do when I go back to work? How can I protect myself? And so if your employer, like I said, is only offering a temperature screening, that's simply not enough. You're going to miss people that might have been exposed to coronavirus infection that might actually have other symptoms and are just not feverish. And so we don't want to rely just upon that itself. You can also have people that just don't have symptoms at all, and many of these people will recover without incident. But again, like I said, with all that's going on in the country today, we're probably going to see some additional waves of this, just given all the civil unrest that's out there. The pediatric world is sort of exploding right now with this multi-inflammatory disease. So if you have children or grandchildren, this is something to carefully watch. Unlike the adult symptoms with the pediatric cases we're seeing, these are patients that sort of present like colds, a little bit flu-like. They may have a fever or a runny nose. A lot of these children are having gastrointestinal upset, so they're having some vomiting and diarrhea. And so while the presentation of these kids is different, the severity can also be pretty high. We're also getting additional data in that tells us a little bit more about safety for pregnant mothers, and we'll talk about that here in a second. A couple of things that I want to make sure that we review and are focused on very carefully is sort of how does this virus get transmitted, and what are sort of the short and long-term priorities for us to stop it in its tracks. I'm always drawn to a statement that a colleague at the CDC said years ago to me, and she said, Hudson, if we just washed our hands, we could eliminate about 80 to 90% of the world's infections. And, if you were to add to that vaccines that are effective and safe, we can even get further towards that eradication or elimination of this virus. But the best way that we can prevent illness is to simply not be exposed. So if you're going back to work or you have to go to, a daycare or something like that, you can't control everything that takes place there, but you can certainly protect yourself, staying away from other people. If you're sick, stay home, for example. If you are going to have to go out to wear some type of mask or face covering, making sure that you wash your hands with soap and water and alcohol-based hand sanitizer, these are all critical aspects of this. And I'll tell you, I've seen many businesses have stepped up to the plate with very limited resources and probably very limited funding to do just these types of things to protect their customers and their staff. I went into a local Walgreens the other day, and I was very impressed with how cognizant the hand hygiene of the employees was, that they were all wearing masks, that after every customer they washed their hands. So there's a lot of different places that are really stepping up to the plate. But what does this mean for the future? Well, we're now in June, and we're going to continue to see elevated humidity and elevated temperatures outdoors, which is good for viral sort of destruction, if you will, but it's not going to necessarily help the virus inside a human body. And so while the environment of care, the things that we might touch outside, like going to a gym that's outside or a playground or something like that, the risk is going to slowly start to die off a little bit because the UV radiation will be effective at inactivating this virus. We still need to be very concerned about social distancing, making sure that we stay home if we're sick, ensuring that we're wearing the face coverings, and certainly staying away from other people that might be ill. And so that's really that new normal of COVID-19 that's going to teach us. I did want to provide a few updates on what's going on federally. From our last webinar, if you participated in that, we've seen a lot more distribution of these antibody testing, and we'll talk a little bit about what that means for you. We've seen an increase in the amount of testing that's taking place across the United States. At the very high point, if you looked at some of the local jurisdictions, especially like New York City, when we looked at overall populations that were being tested, about 25% of some populations in different areas were positive out of the tests that were performed, and we've seen a drastic reduction in that, which is an excellent sign. I'm also going to show you here in a second to look at your actual state, to know where you are. One of the big questions that always comes up is, what is my local area doing, and is it safe for me to travel? And as we move towards these vaccine trials getting a little bit further along, hopefully, crossing my fingers, we'll see an excellent, safe vaccine that will be produced later this year. And really, for the first time ever, we're seeing manufacturers and the government do what we call vaccine production at risk, meaning that they're taking the current version of the vaccine being tested and already developing massive stockpiles of that, so that if we get FDA approval for those vaccines, they can immediately be launched to the public. And the federal government is really strongly committed to providing this vaccine to everyone in the United States, which hopefully people will take advantage of. And even if they don't, we'll see some benefit of that herd immunity, meaning that we'll see people that will get the vaccine will help others that choose not to by protecting or providing a little bit more community protection. And as I mentioned before, with all that's going on right now in society, we need to be very, very cautious about where we go, who we're associating with, and the fact that we need to make sure we wear a mask or a facial covering at all times if we can when we're going out in public. Because if you look at the news media, there's lots of people on TV right now not wearing masks that are extremely close together. And so the last thing we want to do is see, peaceful protest turn into a COVID outbreak and another wave. I did want to give some perspective on where we are as far as global versus the United States. So on the left side, as I talked about in the last program, you can see the total number of coronavirus cases. So we've gone up fairly exponentially. If you look at the U.S. number there on the left, it's 1.7 million. And we've seen, close to 400,000 deaths from that. If we drill down a little bit into the United States, you can again see this heat map that shows by specific area, by state, as well as by county, where we're seeing the majority of resources. And so if you're thinking about this from a public health perspective, or as a consumer of healthcare services, or just someone in the public that's concerned, the areas that have this darker heat map are indicative of having ongoing outbreaks. And so we want to be aware of that, but we also want to make sure that we can maintain a safe, normal life. And so if you're interested in more data about your specific county, the reference is on the bottom of the slide, which Judy has kindly updated in the handouts tab. And you can actually click that and go right down to your county level. One thing I would caution you on is that if you live in a county, so for example, I live in metropolitan Atlanta, about 6 or 7 counties essentially make up the metro area. And so don't just look at your county in which you reside, but also look at the counties that surround you where people might be commuting back and forth, because that's important to think about the potential risk that's out there. John Hopkins has come up with a new graphic, which I think is outstanding, and it's done by state. It's a little bit small, so I apologize for that. But on the left side, you're going to see essentially the greener the background, the more we're seeing what we refer to as a downward trend, and that's good. When you see a more reddened background, that's where we have an upward trend of new cases in the state. And again, for purposes of interpretation of this, just because you have an upward trend does not necessarily mean that you have a public health crisis. It could simply mean that you see more positive cases. But what our goal is to keep these people, as safe as possible, keep them out of the hospital unless they need it, and ensure that we have adequate hospital resources to care for them. So, for example, you'll see certain states like Connecticut are at the green. You'll see, D.C. is another example, and then you'll see states like Alabama that are a little bit more red. And so it's important to note that this number changes on almost a daily basis. But if you're interested in drilling down again into your state information, you can click the link there on the bottom, and it'll take you directly to that. But again, what we're trying to do is get all of these boxes to green. That is our goal, and then certainly keep up some emphasis. As Judy and I were talking right before the webinar program, she made a pretty astute statement, and she said, I'm a little bit worried that people are thinking that, this is no big deal anymore, and they're sort of backing off of their preparedness and response, and that's something that concerns me as well. So I agree with her. This is not something that's going to go away overnight. And really, until we get a vaccine as well as good treatment options, it's a very important thing for us to think about. And so we want to be very aware of our surroundings and continue to monitor our local information. As I mentioned before, this data that's available from CDC is updated every single day. When you look at the total number of deaths, the United States has gone over 100,000 deaths. And so the number that is asterisk, you'll see that from yesterday, which was, this was actually updated on May 31st, so not today yet. Compared to May 30th, there were 915 new deaths, and there were about 23,000 cases that were new as well. This is a little bit more detail regarding the state. So if you look at states like Georgia, where I live, you're going to see more cases. And again, proportionally, as we do more testing, we're going to see more cases. And again, my red flag goes off when I see sort of the following: increase in cases, increase in hospitalizations, increase in deaths, and not enough hospital resources. So those are sort of the 4 parameters that we look for in the healthcare space to say, are we at a sort of red alert level, or what do we need to do? And unfortunately, we continue to see massive outbreaks in the long-term care setting. So for any of you that are on the phone call today that have relatives in long-term care, please make sure you stay in touch with them. Please feel free to ask for the infection preventionist at the long-term care facility. Make sure you're checking on these loved ones via phone, Skype, whatever means you have access to. And certainly, feel comfortable asking questions about what they're doing to keep residents safe. we know that long-term care is a sort of a hotbed for COVID infection, not just because of the residents, because keep in mind the residents aren't going anywhere. They're not leaving the facility for the most part, especially in skilled nursing. So that tells us that these infections are coming from the staff members coming in. And so it's not only good enough to have your healthcare providers practice good infection control while they're at work, but we also have to educate all workers when you're away from work what some of the safe practices are as well. The most vulnerable populations, as we've talked about before, are specifically about people that are over 65 years of age and that have chronic health conditions, certainly those that are in long-term care facilities. We have seen just as early as this morning, there was a new study that came out that 1 in 10 people that get COVID infection and are hospitalized that are diabetic actually won't survive. And that's a pretty alarming statistic. So some of these health conditions, especially the chronic ones, even if well maintained, can increase the risk for severe complications from this. And so if you fall into these buckets or know anyone that does, pay special attention to these individuals to make sure that they're taking the necessary precautions and social distancing as well. Interestingly enough, there was some new data that was released from the CDC that looked specifically at the age populations and the number of cases. I don't know about you, but I was a little bit surprised to see this new updated graphic that was released yesterday. If you look on the far right, you'll see the people that were 65 to, essentially 75 plus. But notice the increase in cases in the 18 to 44 age range. Notice how many cases are in the 45 to 64 age range. And so that tells us that the most vulnerable populations might be somewhat shifting, and they're not just the elderly. They're not just people that are in those high-risk settings like long-term care, but it very well may be people that are living in the community, working normal jobs, that unfortunately are succumbing to this disease. And so this is something that we need to be very carefully monitoring in our local communities and ensure that we're not just thinking this is something that's going to affect the elderly folks. And the last set of numbers, which I hate to share, but I feel compelled to, is the number of cases and deaths amongst healthcare personnel. AVA primarily serves healthcare personnel, but has a large constituency of patient safety professionals, advocates. We have pharmacists, we have physicians, you name it. That's what makes AVA very special. But we also want to recognize the tremendous work that's being done by the healthcare professionals across this country and across the world. These are individuals that are coming into work knowing that they're in danger. In many cases have not been provided the proper personal protective equipment, or they can't, certainly reuse it multiple times is what's happening a lot of times. And so the total number of cases that's been reported in the U.S. has been close to 70,000, and we've unfortunately lost 318 healthcare providers from COVID-19 infection. And then finally, I had mentioned earlier that the total number of positive tests is declining, and that is excellent news. I want to continue to see this number get closer and closer to zero. And so out of the almost 17 million tests that were performed, we're seeing about 12% of those tests are actually positive. There are ways to sort of drill down into that information and understand who those people are, where they're coming from, and the geographies. But again, what we're trying to do is stop community transmission. This is critically important. We have a fairly good handle on this in the healthcare setting, but we need to do extra work, especially as businesses reopen, especially as daycares and churches reopen. There's been multiple outbreaks in places of worship related to singing as a perfect example. And so this threat has not yet left us, and we need to be very, very cautious about that. There are some steps that we can take every single day to not only reduce the risk of COVID-19 infection, but honestly to reduce the risk of transmission of any infection. So the good news is that while COVID is something that's novel, we don't have necessarily an approved treatment, and we don't have yet a vaccine. It is very similar as far as transmission to other viruses that we've seen in the past, like MERS and SARS. So if we wash our hands with, again, alcohol-based hand rubs, all of the ones that are commercially available that are alcohol-based are going to be very effective if you can get your hands on them. I know several people emailed me after the last program and said, where can I get some? Well, there are places on Amazon that I've seen that have had some stuff hit or miss. There's been, large box retailers like CVS had some this past weekend I was able to snag. But you can also make it yourself. The CDC, as well as the World Health Organization, do have guidance that's pretty simple to follow if you can get the active ingredients, and you can actually make your own hand sanitizer. But again, soap and water is extremely effective as well. It's just not always practical if you don't have, a sink in your car, for example. The second thing that we need to do is like always, is we need to stay home if we're sick. And that goes for all year round. As employers, though, they need to honor that commitment and ensure that there's policies and procedures in place to afford you the opportunity to stay home. If we're not financially incentivizing you to stay home by penalizing you, especially when the majority of Americans live paycheck to paycheck, we're setting ourselves up for failure. We don't want someone preparing the food that's sick. That's a standard health department regulation, and we need to have the same thing in other occupational places as well. So if you're sick, stay home. Make sure your employer is working with you to keep you safe. And certainly, if you have someone that you need to be around that becomes sick, isolate that person. It is certainly acceptable to bring relatives home that have COVID-19 infection if you self-isolate them. And we can talk a little bit about that during the question and answer period, but we recognize that the hospital is probably not the safest place to be. Long-term care is certainly not the safest place to be. And so if we can care for folks at home and properly deliver that social distancing and isolation, then we're going to be in a pretty good position. And a couple other things that I'd like to mention are really looking at the surfaces and the items that we touch on a frequent basis. I don't want everybody to turn into a germaphobe and run around and, try to spray stuff everywhere. That's really not what we're trying to achieve. What we're trying to do is look at making sure we wash our hands, that we don't touch our face, our eyes, our mouth, or nose, and that we disinfect things that we're touching all the time. So if you're going back to work for the first time, I would absolutely at the beginning of every morning wipe down my computer keyboard, wipe down my phone, wipe down my mouse, and do that at the end of the day as well. And that's going to be a very simple technique in order to keep us more safe. And certainly we want to practice respiratory etiquette. These are basic things that we should do. And as we move through the summer and quickly into the flu season, these are steps that we always want to take by making sure we don't allow those respiratory droplets to spread as much as possible. I really like this picture because it shows, again, the personal humanistic side of this infection. And while there's been some terrible things that have happened as a result of this, I've also seen some amazing things. I've seen clinicians, especially nurses, hold the hand of patients at their last breath because their family couldn't be there. I've seen clinicians bring in iPads or use their own personal devices to connect family members. I've seen family members standing in ambulance bays that were waiting to tell their loved one goodbye, and they couldn't get into the healthcare facility. So the amount of stress that's on healthcare workers right now is enormous. The amount of stress and anxiety with our patients is even bigger. And so, certainly if you know a healthcare provider, make sure you reach out to them, check on them, make sure you tell them thank you for the work that they're doing during this pandemic. And it's extraordinarily rare that we would talk about the word pandemic, which means that global threat of infectious diseases, yet see so many layoffs in healthcare institutions because the general volumes of patients have been so way down. I did want to address some of the misconceptions related to cloth face coverings. I continue to be just astounded and alarmed with how many people are wearing these incorrectly and wearing them at times that they don't necessarily need to do that. If you are driving down the road in your car alone, there is absolutely no reason to wear a cloth face covering. There's also no reason to be wearing gloves to touch your steering wheel. What is recommended, however, is to wash your hands. I would not have any problems at all if you're going to a gas station and you wanted to put on a pair of gloves to pump the gas and then wash your hands afterwards. I personally do that myself, but I don't wear gloves when I'm driving down the road. I don't wear gloves if I'm in a car alone. I certainly don't wear a mask if I'm going to be outside in my own driveway or something like that. So we need to be, prudent about this, but also not go overboard. These masks are not necessarily the most comfortable thing to wear. I've had to wear them for 14 to 16 hours a day. They're extremely uncomfortable to wear, but they do provide some level of protection. And the good thing is that when we have a mask on and that other person we interact with does as well, that substantially reduces the risk of potential infection and transmission. So, don't feel like you have to have a healthcare grade mask. Judy and I were sort of laughing that we've seen people in full respirators in Costco and stuff like that. So it's not that we need to go overboard. Again, it's to make prudent decisions to protect ourselves. CDC has also put out some consumer-based graphics that help us better illustrate the risk associated with common activities like pumping your gas or going to the grocery store. I can tell you this, if I see you in the grocery store and you're wearing gloves, I'm going to say something to you because you're going to contaminate everything that you touch. So the gloves are not just for your protection, but we should also use them to protect the things that we're touching. So the overuse of gloves is not a good thing, especially with the spread of infectious illnesses. So use them when needed, primarily for patient care. So if you're doing any type of caregiving, that would be appropriate. Or if you're going to touch probably a very heavily contaminated item like a gas pump, I think that would be a reasonable, acceptable thing as well. Several people have asked already about traveling during this pandemic. For purposes of this discussion, I'm going to probably focus on the airline industry because there's really not been a lot announced specific to other forms of transportation, and certainly cruises is not something I'd recommend right now, nor rail travel. But the airline industry has massively stepped up at a huge expense and developed extensive protocols well beyond what they would normally do. And I think we would all agree, if you've traveled, that the planes are not always the cleanest. But many of the airlines are doing increased cleaning now. The airliners also have HEPA filtration systems that prevent, contamination during recirculated air. And many of the newer airliners actually have a large input of fresh air from the outside during travel also. So you'll see that most airlines are requiring people to wear a mask. They're not passing out food that is going to be touched by flight attendants. So everything is pre-sealed, ready to go. Hand sanitizer is readily available. Certainly you can wash your hands in the laboratory as well, and they're also changing their boarding procedures. So if there's anywhere I probably feel safe, the airline industry, I think, has done a fantastic job of not only meeting the CDC requirements, but really trying to innovate in this area to make it safer for both their staff as well as the flying public. And part of that goes right back to that basic intervention that we have, which is washing our hands. This is so critical that we continue to do this on a frequent basis to stop the spread of multiple different pathogens, not just COVID-19. And as I mentioned before, there's a lot of emerging evidence and discussion about, can a pregnant mother pass COVID-19 to her child? And the answer is yes, that can happen. It is not frequent, but just here in Atlanta, it is happening. And I know personally of several places that are reporting this as well. And so as more data becomes available, I think we'll learn a little bit more about this. Ideally, what we'd like to do is get to a point where if the mother becomes infected, we have some way of prophylactically, sort of preventatively treating the infant before they're born, but we're not yet there. So far, most of these children that have been born positive have not had any specific complications that we're aware of. But again, this is an area of study that is continuing to be evaluated. So again, if you become sick, the first thing to do is go home. Make sure you don't infect other people. Isolate yourself away from other individuals. Look at your signs and symptoms. Do you have a fever? Do you have any dry cough, shortness of breath? Did you have a sudden taste, and taste or smell is another telltale symptom. And if you live with someone else, make sure you don't share any personal items, like toothbrushes is a huge one. Why people share toothbrushes, I couldn't begin to tell you, but it continues to be reported. And so we always recommend avoid sharing personal items just in general. And the last little area that I'd like to talk about before we go into the question and answer period is on the last program, there were a lot of questions about which test should I get and what does it mean? And so I wanted to review the viral test, but then give you some of the new guidance related to the antibody test. So the viral test is the most commonly administered right now. It is a rapid test is available now that tells us, do you have the virus or do you not right now? So it is a good test to determine if your symptoms that you have are actually true COVID infection. We are also seeing some people that are being tested that don't have any symptoms at all. And so that tells us how many people didn't even know they had it, but actually do. Whereas the serology test, the one that's looking at the presence of antibodies, is going to tell us, did we ever have the infection? And those antibodies can take several weeks to form. So if someone has a positive antibody test, that is simply saying that you actually were exposed to the virus and that you developed some level of antibody, some level of protection against the virus. What that does not mean, however, it does not mean that you are immune. It does not mean that you cannot be reinfected. And so we want to be very, very cautious about this. And I see a lot of employers, especially ones that have reached out to me, that say, I want to do antibody testing for all of my employees. And if they're all positive, if they all got antibodies, I'm going to let everybody come back to work. Well, that's not how that works. And so, those that have symptoms certainly should get an initial corona test. They could certainly get an antibody testing, several weeks after the infection resolves, but that does not tell you that that employee will not get the infection again. We don't yet know what the presence of antibodies and at what amount specifically means as it relates to immunity or prolonged infection risk. And so this is something that we want to be very, very cautious of. The negative antibody testing simply means that you have not had the infection before. Both of these can have a small rate of error. And so certainly if you don't have any symptoms and you test positive for actually having COVID-19 infection currently, so again, that regular blood test, then you can have that repeated. You could certainly, if you had some symptoms of several weeks ago and you really weren't sure what they are, the antibody testing will tell you if there was potential exposure to COVID-19 infection. But again, if it's negative, there's always that small possibility that it was inaccurately interpreted. So don't assume that any of these are 100% effective, but they are very, very highly effective. And so this is something that we want to think about. And you can also be tested too soon. So if you get tested the day after you have your symptoms resolved, you're not going to see the presence of antibodies. Antibodies don't happen overnight, and nor do you need to be tested immediately after you're exposed. Because if you're exposed at 4 o'clock in the afternoon, and to a high-risk scenario, you're not going to test positive at 6 o'clock in the afternoon. The incubation time period is longer than that. We are seeing some additional development with treatment options. Remdesivir has been distributed to all 50 states and U.S. territories. It has shown some tremendous promise in reducing length of stay and sort of the bad outcomes associated with hospitalized patients. And we continue to see a variety of other treatment methodologies being studied. Again, convalescent plasma, as I discussed on the last program, has shown incredibly strong promise of taking essentially the antibodies and the plasma of people that have recovered and then infusing that into others that really need that. And again, we're going to continue to learn more about what this is. The treatment options change every single week, and that's good. That's what evidence-based medicine is all about, and that's what you want your healthcare provider to do. And the last thing that I'd like to share with you, which is a fantastic tool. So if you are not a healthcare provider and you're looking to evaluate your symptoms and say, hey, I have the sniffles, or I have a headache, or I have gastrointestinal upset, I have diarrhea, what could that be? Could that be coronavirus? And so CDC has developed this new tool, which is really interesting, and it's called Claire, and it's an interactive tool that does screening. And so you can go to the link there on the bottom, and it's an automated, what they refer to as a chatbot. And so it'll ask you questions, and based on how you respond, it will actually recommend that you either don't have coronavirus infection or you potentially do, and it will refer you to steps to get tested. And so it's an excellent tool that's available. If you're an employer that's on the line today, this would be something I would recommend that you add to your intranet as a tool. You can also use it for screening employees as well, but it's an excellent tool that's available free of charge. So as we look into the future with the crystal ball, we will, see, and we've already seen this happen in the last week, some gradual loosening of the visitor restrictions within our healthcare facilities. And specifically, I'm referring to hospitals. We're seeing outpatient services in many hospitals resume. We're seeing elective procedures and surgeries resume. And we're starting to see, more visitors than in the past. That has not, however, happened for long-term care facilities. So the skilled nursing facilities are, in most cases, still on lockdown. And frankly, I don't think we're as close to opening those up as I would like to see. Most of those patients, however, are being tested. But again, a test is only as valid as it is that particular day. So just keep that in mind. We'll also see some changes in societal behavior, I think, and hopefully we'll see some additional social distancing requirements that will allow us to also be more flexible. So certainly take the kids out to play. What we don't want to do is see this social isolation that is going to prevent us from interacting in a normal life. And again, we can interact safely. I have no problem having dinner with someone, especially if I can sit outside. I have no problem sitting in a restaurant that is spacing out tables. The staff are all masked. They're asking screening questions and doing temperature checks when guests come in. And you see frequent hand hygiene as well as disinfection of surfaces. These are all very reasonable activities that make me feel very safe as a consumer. And we'll also see, sort of these long-term changes that are going to come out of this. My hope is that healthcare administrators will have woken up and said, this is something we need to invest in. We need to invest in good infection control. We need to invest in personal protective equipment. And the local and state health departments will start to look at stockpiling. How do we make sure that we're prepared for a future pandemic of the future? What can we do to stop it up front? And how can we prepare the public to have sort of these good basic practices hardwired in the future? And as I mentioned at the beginning of the program, and will remind us again that the most up-to-date information is available on the CDC website that you can see there. I've also included some additional references if you're interested, but remember that everybody is part of a family, regardless if it's your blood family or it's your friends, loved ones, it doesn't matter. And when we look at our most vulnerable populations, especially those in nursing homes, think about the impact to them. Think about the impact to the healthcare worker. Think about the impact to our first responders. Think about the impact to the families of these relatives and loved ones. And it really brings me to a point of recognizing the tremendous good that's been coming out of this. We've seen people come together. We've seen families go through tremendous amounts of stress and still emerge victorious. We've seen many patients walk out of hospitals in a better condition than when they walked in. And these are all good signs. What we want to do is continue that positive momentum and ensure that we can get to a good, sustainable place for infection control, a very good position to treat and mitigate the risk of this virus with the vaccine and good proven therapeutic options to treat it. And most likely we will, continue to sort of adapt to this new normal, if you will. What that will finally look like, I don't think anybody knows, but we really are not going to live in a world where we're wearing masks 365 days a year. I don't see that as the new normal. That being said, there are many steps that we can take on a daily basis that are very non-intrusive that will help us prevent potential illness in the future. So with that, I'm going to see what questions we have. And Judy, I believe you had a few polls that you wanted to ask the audience as well.
I did, Hudson. That was great. Thank you. So you guys that have a computer going with you or are able to, I'm going to launch a couple of polls and then we'll get right into those questions. So to start with, do you know someone that was diagnosed with COVID-19? Basically 60-40, yes. So 6 out of 10 of you know someone that was diagnosed with COVID. Then, let's see.
I'm not surprised by that.
Neither am I. Have you lowered your defenses related to COVID? So that being, are you a bit more cavalier going out in public? Making sure you're wearing your face mask? And we're going to close this one and share. So 71% of you, good job, have not lowered your defenses. That is great news.
That's reassuring.
And then lastly, we're going to do one more, because this kind of goes in line with that one. Which aspects of COVID-19 protection are you practicing? Are you select all that you are doing? Are you staying 6 feet apart? Are you wearing a mask in public? Are you continuing to social distance? That meaning for this one is staying away from all except for the people in your household. And how are we doing with that hand hygiene? So we will give you another second. You guys are doing great voting. Thank you. I'm going to close that poll and I'll share these results. 97% are continuing with the 6 foot distancing. Wearing a mask in public, 90%. 63% are still staying away from all except for the immediate household. And like the 6 foot distancing, the hand hygiene is at 97%. So all in all, this is a great group as far as not contracting. Okay, so let's get right to your questions. We're going to start with, how are the states such as Georgia and Florida doing since they have reopened?
So if you look at the map that I put up from Johns Hopkins, that's really the best barometer if you're looking at it by the state. And again, those numbers and sort of the ultimate outcome is dependent upon a couple things: the total number of new cases, the total number of deaths and hospitalizations, and available healthcare resources. And so that number is not necessarily going to be read per se in a bad way if you're just seeing an increase in cases, but you're seeing a decrease in hospitalizations, a decrease in deaths, and a wide availability of healthcare resources. I think people unfortunately think total number of new cases is the ultimate determinant, and it's not. We certainly want to see that number go down, don't get me wrong. But when we look at states, what we're looking for is, do they have enough resources to care for patients? Are the rates of hospitalizations going up or down? How many people are dying? Is that going up or down? And the total number of cases. So, if you look at Georgia, for example, hospitalizations are down, deaths are down. The total number of new cases is up. And again, that's sort of what I call a yellow light. We want to carefully watch it, but it does not mean necessarily that interventions are not effective. We will continue to see more and more people test positive as the testing goes on. What I'm honestly worried about right now on Monday, June 1st, is what I'm seeing on the news with all these people that are in protest, that are not doing social distancing, that are not wearing masks, that are not doing hand hygiene. I think we're going to continue to see some negative consequences from that, unfortunately, from a public health perspective. But generally speaking, a lot of the states are doing a good job. And again, if you're looking for state-specific data, you can click on that web link on that slide that's just at the beginning of the presentation, and it will take you not only down to the state, but also to the county level.
Perfect. What are airlines doing to improve air filtration risks for those of us that do have to fly?
So most airlines are doing a couple of things. One of the first things is certainly doing symptom screens. So you will probably see in the near future airlines have massive capabilities of just looking for temperature without you even knowing. Certainly they have the right to ask symptom questions if you've been exposed, that type of stuff. They're screening their staff as well, and so they're isolating them and screening them. We've seen a change in the way that airliners are disinfected. So after long-haul international flights, we typically would see a much more thorough cleaning than we would on just like a domestic, quick turnaround, and that's really changed. So most of the airlines have moved to an electrostatic, which is a charged particle that shoots out of a gun, if you will, or a mister, and it sprays the disinfectant into the surface. And so it's a pretty interesting technology that allows for more widespread usage versus just using like a impregnated wipe or spray or something like that. So these technicians can do this after every single flight, and that's what most of the U.S. airlines are doing. And so there's this enhanced level of clean that's taking place after every single leg of the flight, which has never been done before. And as I mentioned before, airliners are HEPA filtered, so the air is going through a HEPA filter, very similar to in a hospital. So, the chance of something getting into the HVAC system is pretty slim. It's actually better than most places, even your car. So these are things that they are doing to proactively address this. But if you're doing all those things and the airline's taking that seriously, I would really have very minimal concerns with flying personally.
Are they still having, or are they separating the seats a bit more now, Hudson?
Yes. Yeah. I mean, most airliners are not full. They're usually putting the middle seat empty. But, again, the key here is source control. So one person has a mask on and the other person has a mask on. That's really your best possible defense, that along with hand hygiene and those types of things.
Thank you. This is a question that I've heard many people, and I, like you, cannot stand it when I see gloves on people in groceries. But why would gloves contaminate everything in a store, but bare hands would not?
So bare hands absolutely can. That's not at all what I'm trying to make the inference here. But gloves, unfortunately, if you're wearing the gloves all day long, every day, you're going to have a high likelihood of also contaminating yourself as well. Unfortunately, we see this in healthcare. When we wear gloves, we feel like they're sort of an extension of our body, and we forget to wash our hands. And so really the goal in not wearing gloves in grocery stores and places like that is that you're much more likely to actually have contamination. Those gloves can have the contamination stick to them a lot more than your skin. So our best defense is to make sure we wash our hands as quickly as possible. Now, what would I ideally like to see in a grocery store? Well, I'd like to see beyond the cart wipes that I see at the front door or the hand sanitizer at the front door. I'd actually like to see it actually in the produce section and other areas where you are going to be selecting the produce. Certainly I've seen a lot of grocery stores move away from any items that you're physically touching without them being in the bag. But not everything can do that. It's sort of hard to do with bananas and stuff like that. So, but we don't want to see people wear gloves all the time, and we don't do this in healthcare either. When we are, just sitting at our desk or charting or something like that, we're not wearing gloves. As a matter of fact, when we're not doing patient care, we are strongly encouraged to take our gloves off immediately because they lead to higher rates of contamination. So good hand hygiene is really the best solution there as opposed to glove usage.
Is there an ideal time for antibody testing for COVID-19? And can you address qualitative versus quantitative?
So specifically, you want to wait several weeks. My recommendation would be, 3+ weeks after resolution of symptoms would be the best place to do that. And again, the antibody testing is going to tell you two things. One is, did you have a previous infection? And two, did you develop any level of antibodies to that infection? That does not, however, tell us, we don't know, what the numbers mean, for example. So if you have 1,000 antibodies, as just an example, we don't know if that translates to any level of immunity, and if so, for how long. So I would be very, very cautious to use that test for anything other than understanding, did I have an exposure, especially one maybe that I wasn't aware of. But it's not going to change anything about the way we treat you. It's not going to change anything about if you get to go back to work, if you look at the current guidelines. It is simply a measure in time to say, yes, you had exposure. It's very, very similar to what we do for hepatitis B vaccines, where we actually determine whether or not you through a titer, a blood titer, if you have immunity. What we'd like to get to with this particular virus is that ability, just like we can with hepatitis, to say after 3 shots, you are immune or you are not. And with hepatitis B, you can have many, many years of immunity from that vaccination series. And hopefully we'll get to that place and a little bit better understanding. But again, my estimation based on everything that's been said so far is it doesn't appear that the vaccine that will be coming out will be something that we will have, a long-term immunity to. It'll be, sounds like an annual shot, very similar to a flu shot. So again, that's all in the works. And as the scientists continue to develop that and do the efficacy testing, we'll have a better idea.
What about transmission through the eyes? Is it common, and should one wear protection when flying?
Good question. So, in healthcare settings, we are terrible about wearing eye protection for the most part. It's pretty rare that you see people religiously wearing eye protection. I happen to be one of the people that does. The people that I work with, I've tried to train them to do that as well. It is extremely important when we're dealing with droplets that might contact the mucosal membranes of our eyes, mouth or nose. That being said, there is not a current recommendation for just general public to wear eye protection. Where we do wear eye protection is in high-risk environments like healthcare settings where there's a high possibility that we are going to be dealing with a patient with infection. So, I don't think it's necessary to wear eye protection when you're sitting on a plane because, again, hopefully if the system is working somewhat correctly, you are going to be screened before you get on and ask questions. You're going to be wearing a mask. And hopefully people will be, responsible enough to not get on the plane if they have any type of symptoms or it will be immediately discovered. So I don't think it's necessary in a general speaking. Now, that being said, is it a terrible idea to carry some safety glasses with you should you need them? I don't think that's a bad idea at all. Because again, when we're dealing with respiratory droplets, there is certainly that possibility that they can contaminate the eyes. We don't yet have data that supports how frequently that happens. The majority of respiratory viruses are transmitted through the nose. But again, we don't really know what that is yet. So I think there's a little bit more to be determined there.
Perfect. One question is, can you repost the references again? That is something we definitely can do. And if you'd like, we can even send them to you, and you can send that request to avaed@avainfo.org, and we can make sure we get those for you. Will you talk about the news stories being shared that hospitals are marking patient deaths as COVID-19, even if it wasn't, because they get paid more?
I will give the most concise answer to that question that I know how to give. There's a lot of speculation around this. The way that deaths are reported is primarily driven by the State Department of Public Health in each jurisdiction, and there are federal funds that are being distributed, obviously, to assist hospitals in caring for COVID-19 infections. So I think it would be a fair assumption to say that there's probably some fraudulent activity out there. And the most important thing from a public health perspective is to report deaths accurately. So if the cause of death was a heart attack and the patient still had COVID-19 infection, if the heart attack was not caused by COVID-19, then the cause of death should be a heart attack. Same as if somebody has a stroke. Now, with strokes in particular, we're seeing a lot of strokes are actually caused by COVID-19 infection, where the blood essentially becomes thickened and it can form a clot. That would be appropriate to list that cause of death associated with COVID. And so it's very subjective is the best way I can answer that. And so, I can't speak to how often that's happening, but that is certainly something that CDC is aware of and is working with the State Department of Public Health to try to resolve, as well as Centers for Medicare and Medicaid Services, which is the largest payer, is engaged in this conversation as well. So there is some truth to that statement. Whether or not it's directly and intentionally fraudulent versus some misunderstandings, I think that's a conversation much deeper than today's webinar. But we always want to have accurate reporting of deaths. We want to understand what the cause was as much as possible, and we want to understand the burden of disease, so that from a public health perspective, we can provide the best guidance to you as a consumer or as a healthcare worker to protect yourself and your family.
When going to the hairdresser to get a cut and dye, should I wear 2 masks for more protection? Or should I just get a cut to minimize the time with the hairdresser, assuming the hairdresser wears a mask as well?
I'm not sure what a cut and dye is, but I'm assuming that I'm assuming that is a prolonged process. And so the best thing that we can do, is to continue to maintain some semblance of our normal life. And so I don't really have any problems with you going to get this process done. What I would encourage you to do is to not wear more than what's necessary. So wearing 2 masks is not going to be more effective than wearing 1. As a matter of fact, we know that when we wear more personal protective equipment than needed, it actually increases the risk for contamination, because we probably mishandle it. When we take it off, we might become contaminated. That being said, for example, in Georgia, the cosmetologist here are required to wear a mask. The guest is strongly encouraged to wear a mask, and in my place, they actually require you to wear a mask where I go. If they are doing any type of procedure that's going to be really over your face, you'll see many of the stylists will actually wear a face shield. And so I think really a face shield as well as a mask for your stylist and then a mask for yourself is an excellent form of protection. It's very reasonable, because if you were on the last program that I did, there was a great study that came out that really looked at the effectiveness of face shields. And they don't have to be high tech. They could be some of these homemade ones that are 3D printed that we're seeing being formed. Had up to a 99% reduction in the sort of transmission of viral particles to the other person. And so if you use that in combination with the mask, you are extremely safe from contamination. And so that would probably be my recommendation. If you're just going to get a haircut, a mask for you and a mask for them is very appropriate. But if it's going to be something more, I'm thinking about like when men get a shave or something like that, a face shield would be a very appropriate thing to do. So hopefully that answers your question.
I think it does. The World Health Organization now states you don't need a mask. Why does CDC still recommend?
CDC is doing things that are based on data that they are collecting. That's a little bit of a political and tough question to answer. So keep in mind that the World Health Organization primarily serves underserved areas of the globe. And that's a very needed thing, because when you look at pandemics like Ebola, when we had outbreaks of that, for example, having resources on the ground with, sort of the state, the local jurisdiction, the federal jurisdiction, and international is really important. But I'm not necessarily sure why WHO changed that, because there is absolute evidence that this is a droplet something that is suspended in the air for a period of time and falls type thing. And that is very similar to flu, MERS, and SARS. And so to tell people to not wear a mask right now, I don't think is a very wise thing, which is why CDC's not removed that requirement, especially when we have community transmission. As I said at the beginning of the question and answer period, I do not think that we will be wearing masks in a year. That's certainly my hope. I don't think we're going to be a country that's going to be wearing masks for the rest of our lives. That being said, when we have sort of these high-risk activities in healthcare or we have ongoing community transmission, wearing a mask or a facial covering is extremely strong as a recommendation. So I would really stick with that. Not to discount the WHO or the good work that they do, but I'm specifically looking at CDC evidence that we have here in the States, as well as the documented community transmission. So I think it's a wise idea to continue it right now.
Me too. So Deborah would like to have her son see his grandparents this summer. What is the best way to accomplish that safely?
Judy, did we lose you?
No, I don't think so. Can you? How about now?
Yep, go ahead.
Oh, so sorry. So Deborah would like to have her son see his grandparents this summer. What's the best, safest way to accomplish that?
I think that's a great idea. Grandparents need love. If mine were still alive, I would certainly love to see them, and I can only imagine what it would be like if they were in a nursing home and I couldn't see them. So I think anything that we can do to do this safely is a win-win. That being said, there's some quick, easy strategies that I'd recommend for this. Certainly, if those grandparents had health conditions that were problematic, then it might not be advisable to do that. You could also do something innovative and step outside of the box and actually visit them outside. So maybe you're in one corner of the backyard and they're in the other, and they're over 6 feet away, and you can still interact with them. I've seen some really creative ideas where grandparents had long tables in the backyard, and they sat at one end and the family sat at the other end, and they were 10 feet away. And everybody was wearing a mask to engage. And, these are easy strategies. Use the outside to your advantage. Fresh air is good for all of us. The sun is good for killing this virus on surfaces. Seeing our relatives is a good thing emotionally, physically, spiritually. It's all good. Certainly check temperatures before your grandchild were to go and visit. Make sure that they're not symptomatic, all those types of things. And I would recommend that both parties wear a mask. I don't necessarily think that it would be great to, have people up in close quarters right now, but you can certainly accomplish this, with very minimal interventions that will still allow you to have that family time. And I can only imagine how excited those grandparents will be for their grandson to come and visit. So I think it's a great activity.
Colleen asked if this webinar will be recorded and be available later. Yes, it will. I'll have it up on the AVA Academy by the end of the week, I believe. So you're welcome to go there. There's never a charge to go view. So all you have to do is log in and you can watch any of the webinars. Is the idea of Little League Baseball and other sports starting up again a wise thing? Any suggestions for during practice and games for teammates who share bats, helmets, etc.?
So, it goes back to my statement earlier. I think our opportunity to engage as a society is really important as long as it's done safely. We can't continue lockdowns for indefinite periods of time. If you're a parent, you probably are desperately wanting your child out of the house for your own mental sanity. So, there are probably some ways that this can be done easily. Again, very similar to what we would do if you come in a hospital. Check the players, check the coaches for symptoms and temperature. Make sure that they're socially distanced. Don't everybody sit on the bench at the same time. Space them out. If you're using a metal bat, those are easy to disinfect. You can even spray those down. If it's a wooden bat, that's a little bit more difficult. And so if you have scenarios like that, you could look at some type of protective covering. If you can't actually disinfect the bat, would be one opportunity. You can require the players to wear gloves. Like their normal batting glove would be fine. And then that needs to get washed after every single practice would be another thing you could do. It's not really necessary to have players in the outfield wear a mask, I don't think. I think that's probably a little overboard. But if you're going to be somebody who's going to be tagging another player, it would probably be wise. So if I'm like a first baseman or something like that, then that would probably be wise. And then certainly disinfection of the contact surfaces like, balls and stuff like that is really going to be helpful. And then hand sanitizer. So if you were to think about a traditional baseball game, have hand sanitizer when they go out on the field, have hand sanitizer when they come back, and just like you give everybody a high five at the end of the game, everybody gets to wash their hands, and then disinfect those bats. I think that's a really safe practice to allow us to do this. Again, the outdoors is our friend. So the more that we can space out and get fresh air, the better off we are, and we can still have fun. So I think that's an easy way to accomplish that.
Absolutely. So Deborah's coming, she's the one that wanted her grandson or her son to go see grandparents. Her further concern is he'd be staying with the grandparents for a few days. So if you could add a little dialogue on that.
Yeah, so I mean, again, it really depends on what their age is and their overall health risk. So if that grandmother, for example, is a diabetic and has COPD and congestive heart failure and asthma, then that might not be the best thing. But if the grandparents are healthy and the child is healthy and everybody is wearing a mask when they can and staying away from each other as far as sitting right there, I think that's okay. That being said, that can be a little bit difficult when you're eating and stuff like that. So, I think a short day visit is a great first start, especially one where you can sort of engage outside in an outdoor activity or, go to the lake or something like that. But I think you can still do the several day thing safely. You just would want to make sure that the child is able to engage in good infection control practices as well as the grandparents. Depending upon the age, that might be a little bit easier than other things.
True. Well, Hudson, that was the last question we had. If anybody
I think there was one more.
You do? Oh, maybe I got.
Yep, I see it. It says a student from South Korea wants me to host them for education purposes for 10 weeks. Is this safe? So, this one's a little bit tricky. So depending upon what country the student is coming from, there may be a mandatory self-isolation period. I don't off the top of my head know if South Korea is currently on that list, but if I had someone coming in from another country that was, having high community spread, then I would personally recommend isolating that person for the incubation period before allowing them to enter into their normal daily activities. That's going to be the safest thing to do. I believe that many of these countries with ongoing threats are not currently being permitted to come into the United States, but again, I'm not sure if South Korea is on that list. They have had another wave that's come through. So, I'm not saying, no, you can't do it, but I would first start with sort of the regulatory legal requirements associated with, coming in through border protection, and then look at a self-quarantining period where that person could be isolated to make sure that they don't have any symptoms. There are also countries right now that are doing rapid tests prior to boarding. So if that is an available thing and that person has had no exposure, it's been, several weeks since they've been around anybody else, they tested negative, and then maybe have them tested again when they get to the United States, that would give me a higher level of comfort from that question. So hopefully that helps answer Catherine's question.
I think it does. Another couple questions have come in since then. So guys, keep them coming. We'll make him work all day. I love this. Is more than 6 feet recommended now as far as distancing?
No, 6 feet is still the sort of core recommendation. There has been a large amount of evidence that says these droplets can go further than that. I've seen some data that's gone up to 20 to 30 feet. We've seen a lot of this with people that are singing. So if you're in a church choir or something like that, that is an activity that does have concern for me. Making sure that everybody's spread out, that everybody's wearing a mask would be really important. And, this is why having the live streams and stuff like that has not only been a really cool thing to see houses of worship really step outside of their box. And some of the amazing music that's being produced by some of these churches and with Zoom and some of the other technologies where you have 40 artists at different places, all sounding unanimously, the same, is pretty stellar. But 6 feet is still the core recommendation right now. Certainly, if you can have more distance, that's fine. But 6 feet is really the core minimum, because a lot of the respiratory droplets will fall at that point. And what our goal is to get them to fall to the ground. What is sort of an unknown in this equation is how long do those droplets potentially suspend themselves in the air? And certainly, again, I want to be very, very clear in saying this, that this is not an airborne transmitted disease like tuberculosis or like the measles or anything like that. But there is some evidence that says it can stay around for a little bit of time. The latest data that I saw was up to 3 hours. And so our goal is to make sure that we have good, adequate ventilation, that we are wearing some type of face covering, that we're not around people that are sick. And if you do become ill, that you either self-isolate or you seek healthcare services, and let your healthcare provider know before you're coming. What they don't want you to do is certainly show up to a doctor's office or show up to an urgent care or show up to the hospital without calling ahead, so that they can prepare for your arrival. But I think 6 feet is a good core recommendation to stick with for right now.
So Deborah's husband had to take a plane trip. He returned home 8 days ago. Do you think it's good or okay to relax as he's asymptomatic right now?
If you look at the CDC recommendation, self-monitoring would be appropriate here for 10 to 14 days. Again, I have a very high degree of confidence in the U.S. carriers that they're going above and beyond CDC recommendations. Most of the airlines have actually been working directly with the CDC. So not only are they doing what the CDC asked, but they're really trying to go above and beyond, because as you can imagine, this is a tremendous financial hit for their industry. And so anything that they can do to increase the flying public's confidence in their processes is going to be really helpful here. So if he's asymptomatic, no one was on the plane symptomatic, I think you're in a pretty good place. And, I would certainly monitor it out to the total incubation period, which is 10 to 14 days. But I wouldn't have any big concerns personally.
Perfect. And now we're back to our last question. Can you explain the chart that has the number of cases by age group?
Sure. So that chart is looking at the total number of cases that specifically are within an age group. It doesn't look at geography, and it doesn't break it down by comorbidities or health conditions or any other patient demographics. And the reason that I shared that was that we've historically seen the majority of people in the new case population being at sort of that 60, 65 and older category. And we've seen a little bit of a shift in that lately. So it does not, however, mean that the people that have the complications are not in those groups. So, for example, where we've seen sort of an increase in that younger population, if you will, I believe less than 44 years of age, if I recall at the top of my head, what we are not showing in that graphic is, did they need health care? Did they die? Those types of things. So it's simply looking at the total number of new cases. And so, again, cases is one part of the broader equation, combined with hospitalizations, deaths, and available hospital resources. So when you look at one number, always make sure you look at all of those numbers for your state, especially if you're just looking to understand what's going on in your state as well. So that's just a quick, easy way to think about that.
Beautiful. Oh, a couple more came up. So we're gonna cut it off after these next two. This has been wonderful, but sorry, but if it's been asked, why are N95s not essential for vascular access teams? I've heard some teams are not wearing them when placing lines because it's not aerosolized.
So that's an excellent question. So if you look at, and it's not a graphic that I have here in this particular program, because this was really geared more towards the public, but when you look at CDC recommendations, and the best thing is specifically the graphic that they have for personal protective equipment. There's two images. On the left is what they sort of refer to as the preferred, and then on the right is what they call the alternative. The preferred personal protective equipment for caring for a COVID-19 patient is going to be obviously an N95 respirator or higher mask, gloves, gown, eye protection. Those are the sort of core elements, and that's preferred. The word alternative is simply based on the recognition of a supply chain depletion. And so they're saying if you don't have access to that, then a regular surgical or procedural mask would be, the next best thing. So CDC is still pretty clear that in a non-supply chain shortage issue, an N95 would be preferred when caring for these patients. And so, the question about is a vascular access procedure aerosolized, the short answer to that is no, it's not. There shouldn't be aerosolization during a vascular access procedure, whether it's the insertion of a PICC or doing an EJ or whatever it may be. But the recommendation from CDC has been fairly consistent that, if available, an N95 respirator is preferred or higher. Now, that being said, if I look at the impact of this pandemic long term, if I'm a healthcare administrator, I'm going to honestly look at how do I not be dependent upon disposable personal protective. For myself, and Judy, I think, put this picture up on the first program we did, I wear my own that is reusable. So I have a half-face respirator, and I also have what we refer to as a PAPR, which is a self-contained breathing apparatus that you may have seen on the news as well. So I very, very rarely only wear an N95. I'll typically wear that if I'm darting in and out of a hospital or something like that. But if I'm caring for a patient, I'm going to be wearing that half-face respirator. And the advantage of that is that it's reusable, it's long-term sustainable, it's easy to clean. To me, it's a lot more comfortable. And that is something that I would look at for vascular access teams, is to not just be using an N95 respirator. I know there's a lot of concerns with PAPRs as far as the positive airflow that might be emerging from that and contamination of the sterile field. But N95s have been recommended pretty consistently if available. So hopefully, Kendra, that answers your question. If not, I'll be happy to speak with you offline about that.
So here's a great question that many of us that like to travel are interested in. And I know you're on a lot of phone calls with the CDC and all the other infection prevention groups. Have you heard of anything, or is there any indication when international travel, specifically US, Canada type, may open up?
So the border is open, but for essential travel. And so, that would not include people going to like Mexico for vacationing or going up to, Alberta or something like that in Canada. There has been ongoing discussion of that with Customs and Border Protection and the CDC and the Department of Homeland Security. That is really going to be a data-driven decision as to when we have a good handle, especially in the geographies immediately surrounding those borders. The other thing that we have to be very cognizant of is how much stress and strain this has put on our border control agents and their resources. And so we can't just open the borders if we don't have resources necessary to screen people, because, previously it was screen your passport, those do the security screening. Now in this new world, it'll probably be screened for COVID. So, it may be a Customs and Border Protection officer walking up to your vehicle with an infrared thermometer and checking your temperature and asking you questions. And so all of that takes time, training, resources, the ability to even get an infrared thermometer right now. It's gotten better in the last week, but it's pretty impossible to get basic things like hand sanitizer or thermometers or personal protective equipment in many instances. And so, it's a multifaceted decision that I think will be coming in the next few months, if not before. I would expect that we'll probably see most borders reopen for at least ground travel by the end of June, if I had to guess. But again, the data is going to really look at that, and especially with air travel and international flights, we want to be very cautious of making sure that people are not going to import this virus, especially if there's new variations or mutations of it. We need to be very cautious about how we approach that. So hopefully that gives you a little bit more insight into that.
It did. Thank you so much. Everybody that stayed on today, thank you so much for coming to the webinar. We are planning more. We're thinking about doing a couple in the evening in the near future. So please stay tuned. We're glad you're here with us. And Hudson, thank you so much. This was great as usual. Appreciate everybody. Be safe out there.